Good morning, good afternoon, and good evening to everybody who's listening in to our second international webinar. I am Keith Newton, the Secretary General of the Chartered Institute of Logistics and Transport. And we begin today the first topic in our series of international research items that we're covering to equip our members all over the world in best practice responses. Our theme today is the supply chain response to shortages in medicine and food. And I'd like to introduce the two speakers and their areas of expertise on the topic today. Our first speaker is Dave Howorth. Dave is a chartered member of the CILT in the UK and the Executive Director of SCALA, a major UK supply chain consultancy. Dave has most recently board level experience across UK and Ireland and Northern Europe in the industry with General Mills, and extensive experience in supply chain operations with a number of manufacturers and 3PLs. So welcome to Dave. Our second speaker is Will Holden. Will is a chartered member of CILT Ireland and is the MD of Emergency Logistics Limited. Will too has commercial supply chain background, but for the last 10 years has advised and taught in the humanitarian logistics field, bringing his expertise to countries like Iraq, Turkey and Syria, Southern Sudan, Cambodia, Haiti, and a whole long list of troubled spots in the world. He is on the advisory board of the Humanitarian Logistics Association, who we are partnering with for our bulletins and our webinars. So let's welcome Will. We will have a Q&A at the end of the two presentations when our speakers will be joined by our international president, Dato Radzak Malek. Just so that you know, the webinar is being recorded and will be available to all those who have registered and to other members online after today's session. So that's all from me in terms of introduction. I'll be hosting the session, but I'd like to hand over now to Dave Howorth, who is going to speak on the subject very much with a focus on the UK and Ireland retail and manufacturing scene, drawing out the best practices so far from the crisis. Dave.
Good morning, good afternoon, good evening all. I'm just sharing my screen with you, so hopefully that's coming through for you all to see. Thanks for the introduction, Keith. So yeah, my experience is 30 years plus within supply chain, mainly within the food and drink sector, from a sort of retail, third-party logistics and manufacturing point of view. And I think it's quite clear that in those 30 years, I've not come across anything as dramatic as we've experienced in the last couple of months in the UK and Ireland. This is what I'm planning to run through with you in the next 10 to 12 minutes. A quick summary of what we've experienced in the UK and Ireland food and drink sector over the last 2 months with COVID-19. What the key responses and challenges have been from those involved in that supply chain, but also, what we see as coming down the near future. What do we see as the forthcoming demand and supply challenges as a result of COVID-19, and some key messages around, what we've experienced and what we would like to share with you. So what has happened in the UK and Ireland, and it's reflected on it, we're only actually into week 7 of the lockdown, and the whole COVID-19 crisis is really only about 8 or 9 weeks old. So an awful lot has happened in a short period of time. one of the key things is there's been this huge switch of demand and purchasing of food and drink products from what we would call the out-of-home market to the in-home market. And in-home is fairly self-explanatory. It's what people are consuming food and drink wise in the home. Out of home, what I mean by that is restaurants, cafes, pubs, food on the go, consumption in the workplace. So these two sort of basic definitions of where food and drink is consumed. And what we've seen is a huge switch from out of the home to in the home consumption. And the purchasing of food and drink products for in the home is essentially through the supermarkets and the food retailers. And therefore, their sales have absolutely rocketed when the lockdown was announced. It was almost, you know, when the UK Prime Minister and the same in Ireland announced the lockdown, it was, you know, it just ignited a response from consumers. So we saw a huge increase in purchasing at supermarkets and food retailers, driven by this panic buying, which overlaid the natural switch to in-the-home consumption. And over on the right-hand side, the graph is illustrative, but it's not. But that is the pattern which we saw, a huge spike in sales. So in that 4-week period, for instance, in the UK, there was an additional £1 billion worth of sales. So $1.3 billion worth of sales in that surge. And it was a classic bullwhip effect, where the demand rippled through the supply chain from the supermarkets through to the distribution centers of the retailers and through to the manufacturers. These were the products which were particularly impacted. You can see a common theme in there: long life products which could be stored without risk of running out of shelf life, and some particular interesting changes in consumer behavior, like home baking. There has been a move towards cooking at home, baking at home. Frozen foods, because obviously they can be stored. Interestingly, we saw a 200% increase in the purchase of chest freezers, so low-cost storage freezers. So what was happening in this period was there was a huge move of stock within the supply chain from the manufacturers into the retailers and into the public, into the consumers' kitchens and freezers and pantries. So it wasn't necessarily an increase in consumption, it was a movement of stock. There was a different impact between the larger supermarkets and the smaller convenience stores. Most of the surge in sales was with the larger supermarkets, but the convenience stores also grabbed a piece of that action, but not as much as the larger supermarkets. Some of the convenience stores actually closed because they were in environments where demand dropped significantly. Some of the convenience stores were too small to enable the social distancing. So there was a differing impact from supermarkets to more convenience stores. And of course, if you're in the out-of-home market, what you saw was a complete collapse in sales. You know, the worldwide brands of KFC, of McDonald's, of Burger King, of Nando's, you know, they closed. They closed almost overnight. So there was a collapse in demand for those sales. So what were the key responses and what are the key challenges for those involved in the food and drink supply chain? Well, right across the board, there's been a whole suite of actions around employee well-being of those that are still involved in the supply chain, and the governments have issued guidance that those supply chains, those people working in those supply chains should carry on working. There's a whole suite of employee well-being, workplace distancing rules put in place, upgraded health and hygiene, actions around protecting key roles within the supply chain. And that was across retail stores, retailer distribution centers, manufacturing distribution centers, and manufacturing itself. So that's been a comprehensive development. Also, there's been a significant increase in people resources, particularly at the retailers. So across the major UK retailers, they've employed something like 50 to 60,000 people at very, very short notice as they've tried to accommodate the additional demand. And there's been moves across the supply chain to simplify, to enable the increased flow of product to happen, whilst there's been challenges around labour availability. So things like lead times have increased, things like SKU ranges have reduced to enable fewer changeovers and higher productivity. A move to more full load ordering, a move to more full pallet ordering, all these things to enable a greater flow of product. And then the other key area, particularly for the retailers, is there's been a big growth in online ordering and home delivery. And the retailers have responded to that. So they've struggled to respond to the additional demand. But even so, they've gone from something like 1.5 million delivery slots a week to in excess of 2 million. So that's a pretty big increase, but the demand is actually higher. One of the biggest online retailers in the UK is a company called Ocado. Within the first few days, their system crashed. It couldn't handle the number of orders that were coming through on their online systems. And interestingly, even some manufacturers have started to trade directly with the consumer. So Heinz recently has opened up a direct online and home delivery system, cutting out the retailer and enabling the consumer to purchase directly from Heinz. So these are the key responses. The challenges still remain essentially around labour availability and productivity. Demand is at a higher level, but labour availability and the productivity is lower because of keeping their people safe and not having as many people to operate through through self-isolation. And also the scaling up of online and home delivery remains a challenge. Out of home, as I say, a completely different situation. The demand has collapsed, and so if you're in the out of home market, you're trying to create new demand or follow or identify new demand, but it's not always easy to switch your out of home products to a retail setting. Different packaging, different product ranges, sometimes very difficult to do. Other companies have tried to change their business model. So some of the big food service operators have developed a home delivery offering. Deliveroo, which is present maybe in some of your markets, they've been hit hard because they're essentially in the out of home market. So they've tried to develop a home delivery capability for retailers. Otherwise, it's very much a case of surviving whilst this lockdown is in place, so that when the lockdown is released, they're ready to go. So those have been the responses so far, and I would say that there is food on the table. Maybe availability hasn't been as strong, but the supply chain has been very resilient to this unprecedented last few weeks. But looking forward, you know, we're not out of the woods. There are a number of challenges still coming towards us. So having coped with those, the sort of spring, what I call the spring period, and the social distancing and the surge in sales, the other things that are coming down the line to us are, you know, in Northern Europe, you know, we like our summer holidays. We all tend to go to the sort of Mediterranean and the warmer climates. There's a good chance that that won't happen. And that's going to be a big change in demand. We know that consumer behavior is likely to change as a result of this. Home delivery will be at a higher level. Some things like cooking at home and baking at home are likely to stay around as a new habit. Increased working from home is likely to stay at a higher level. So all these things are going to change behavior. Recession. We know that food and drink tends to be pretty resilient when consumer spending is at a lower level, but nonetheless, some of the figures are quite frightening. And then there's a whole new set of supply challenges. So global trade and ocean freight is starting to become a worry. Warehouse space in the UK is also becoming a worry, particularly cold storage, but also on ambient. And one of the reasons for this is that it's other sectors where demand is very low, but products are still flowing into the UK, which is taking up a lot of warehouse space. So that's a concern. Seasonal harvests is also a concern. That the ones that are particularly labor intensive, that's typically they are, the labor for that is a migrant seasonal workforce that migrates across Europe. And clearly that could be a challenge. And then of course there's a risk of insolvencies. So, you know, are your suppliers, whether they're a material supplier or a service supplier, you know, are they going to be around in 3 months' time, and what's the implication of that? And then if we look ahead to the end of the year, of course, you know, Brexit is still there. Brexit's not gone away, and there's still this big question as to what the new trading arrangements will be between the UK and the EU as of the 1st of January 2021. That's still not clear. But is still being held there by the government as a date that isn't going to change. And in the UK and Ireland, Christmas is a big trading period for the food and drink sector. So companies will need to get ready for that as well. So whilst the supply chain has responded, I would say, very well to unprecedented times, there's still a lot of uncertainty and challenge going forward. Key messages, as you can see, so as I said, response has been strong. The supply chain has held together, but we're not out of the woods. We're now starting to look ahead. You know, 6 weeks ago, we were worried about the next 2 days. Then we started to worry about the next 2 weeks. Now we're starting to think about the next 2 or 3 months. And it's clear that it's really important to know and understand your extended supply chain. You know, and you know, think about your customers, think about your suppliers, and really understand the end-to-end supply chain so that you can mitigate your risks and build contingencies. And that final point at the bottom, you know, for the UK and the EU, Brexit absolutely remains on the horizon and adds a further risk to the dislocation of our supply chains over here. So that's it from me. I hope that was useful and informative. I think I'm going to be handing over to Will at this point. Thank you very much.
Thanks, Dave. So I'm sure will raise a lot of interest across the call. So do post your questions in there. We will come back to all the speakers after Will has spoken. But I'd like to, Will is going to give us a very different perspective now in terms of the whole medicine and food and health supply chain, which has obviously become critical in this current crisis. So let's listen to Will as he talks about that best practice response. Will, over to you.
Okay, thank you, Keith. So good morning, good afternoon, and good evening, wherever everybody is in the world. Over the next few minutes, I'm just going to give a brief, I suppose, explanation of a couple of things which actually relate to the medical pharmaceutical supply chain. Giving you some brief key events which happened between December, January, and into February, actually, which relate to the situation we're in now. And I'm just trying to give some guidance and hints for future commercial supply chain planning. So firstly, let me just share the screen. Okay. So the timeline of a global catastrophe. So it is interesting from my perspective and my background. As I said, I have come from a commercial background and have moved into humanitarian field from 2010 up to the present moment in time. That has actually given me quite a sort of unique perspective and preparation for what is happening right now. And the reason I wanted to give a little bit of a timeline here is to show how much had gone on before most people even knew what was happening. December 2019, China records the first case of COVID-19. January 2020, China locks down Wuhan. First sign of supply chain ripples, not just through pharmaceutical, but in the life science industry, especially PPE. In January, Thailand, Japan, South Korea, Vietnam, USA, Germany, all recorded the first cases. So this is back in January. Some countries send PPE and medical supplies to China. So we found this over the last few months, that there's been a sort of to and fro of pharmaceuticals and medical and PPE going back and forth from country to country. We even saw Italy send certain PPE and supplies to China, and then China reciprocated very quickly afterwards. In February, flights from China were curtailed or cancelled. This was a key reason why the COVID-19 virus spread so quickly to some countries, and for other countries who curtailed or cancelled their flights, reduced the effects and mitigated against the worst cases. In February 7th, WHO reports severe global disruption to supply chains. February 10th, WHO and Foundation for Innovative New Diagnostics signed an MOU specifically to support countries with less resources. On February the 11th, the UN Crisis Management Team was activated. And then following up to February the 19th, severe Chinese lockdowns, travel restrictions. And by this stage, we could see globally, this was all over the news. Now, the point I'm showing here is going to relate to the next slide. And it's something which I've seen over the last few years. And I've called it the tsunami effect. So over various different emergencies I've worked on in the last 10 years, whether it's in South Sudan, Iraq 2014, during the ISIS attacks back then, in Yemen 2017 during the cholera epidemic. And you could see the very same actions, even though they're very different emergencies. There's a whole range of information that's available to everybody prior to the waves hitting. A lot of people are looking at the water receding and not sure what to do. They can't believe their eyes. A lot of people are sitting there and they're looking at the waves slowly coming in. The tsunami does not come quickly, but when it hits hard. And this is the tsunami effect. So a lot of people, there's a lot of information available to people all over the world through various formats, and people did not even realize they were there. So we're going to come on to that a little bit further, okay? And I've seen this in many different situations. So the supply chain response itself. So what is best practice in pharmaceutical medical device supply chains? We have our GMP, GDP, good distribution practice and good warehouse practice. We have our normal industry networks. Demand versus supply, inventory projections. And over the last few months, what we've seen, what we planned pre-COVID-19 and what we're going to do post-COVID-19 are going to be very different situations and scenarios for the supply chain industry, but for the manufacturing industry as well. And again, we're going to touch on that in a moment. What I have seen from here in Iraq, as I'm seeing the whole catastrophe build throughout the whole year, is that there was a huge overconfidence in the supply chain. Okay, I mentioned this back in February to various people I was discussing. There would have been a lot of risk management and disaster risk management processes and protocols and scenarios developed through manufacturing and supply chains, and even at governmental level. There's various countries only last year carried out pandemic scenarios to see how these would affect their supply chains. A lot of the lessons learned from those scenarios last year were never put in place. These are things we have to learn from. So the challenges, and this is one of the reasons I'm working in this emergency management area and sphere. As the guys have said to me here in Iraq, Will, for every solution you have a problem. And one of the reasons is by looking at every supply chain, every business, every industry, you can get into the nuts and bolts of the industry and you can tear it all apart. So for industries that were, for example, the supply chain, medical supply chain industry, it was obvious to me there were certain things going to happen. Okay, it was obvious when the pandemic was slowly, the tsunami was following itself around the world, and people were not reacting quickly enough. Countries were not reacting quickly enough. And then as it began to build within the countries, especially, I think when it hit Italy first, and it really sort of got out of control in Italy, and there was a huge amount of deaths, unfortunately, then all of Europe really stood up at that stage. The problem was, by the time everybody took notice of Italy, the damage was done. And that's the problem. You have to act fast. You've got to act instantly when you see the signs. And that was the point about showing you the timelines previously of what was happening from December, by the way, into February. That's a whole 8 to 10 week period in which most people, you never have to do this because you've never worked in emergencies. You've never worked in Yemen or Iraq, and you've never seen how these emergencies begin in a slow way and usually build very quickly, or sometimes slowly. And that's the tsunami. It comes at you at a very slow pace. So some of the suggestions I'm trying to give people is to look at the gaps in your supply chain. So one of the gaps is information. So how many people in the commercial supply chain would ever look for WHO reports? How many people in the commercial supply chain would look for the United Nations reports? Many people in the commercial supply chain would look at an industry standard website called Relief Web. All these reports are coming out all the time. So while we're looking at COVID-19, there's other situations happening right now, by the way. Okay, so there's always a malaria outbreak in South Sudan and East Africa around this time of year, just because the nature of the rainy season and so on. There's various different other outbreaks of a smaller outbreak of Ebola, if I'm not mistaken. By looking at these humanitarian reports, it actually helps you develop and support your commercial supply chain. Because you will see, if everybody was looking at these reports back in December and January, you could have seen what was happening. You may not have understood exactly how it was going to affect you, but you could have put something in place back then. So that's probably one of the key findings I'm trying to explain to people is there's a lot of information available, and humanitarian organizations, when these type of issues happen, are on the ground. The reports are being developed and they're being shared openly to everybody. So find the gaps in your supply chain. Tear your supply chain apart. Find the threats in your supply chain. So we're looking at threats in relation to production. Dave mentioned about raw materials for food production and the possibility of gaps and challenges and the availability of raw materials. You're going to have the same possible challenges in pharmaceutical production. Okay. Manufacturers have to react to this. So we've been doing this over the last few weeks, is trying to, as sort of conduits between the commercial and humanitarian and the manufacturers and other countries for that matter. Other countries other than the obvious ones, China, Germany, USA, even Ireland is a large concentration, a cluster of pharmaceutical medical device companies and production. But there's other countries available and actually doing various productions like Indonesia, like Dubai, like Turkey, okay? So there's various different countries as well. So how to develop your supply chain and how to react and be reactive to this. And I would foresee companies, manufacturers, suppliers are going to have a much broader network of supply chain operations very quickly. And that's what I'm saying. We're looking at the immediate response, which is reacting, we're firefighting, okay? And when you're firefighting, I've been used to this, I've got a particular good talent at firefighting, but very quickly we need to get into a system where we're planning now for post-COVID-19. And COVID-19 is not going to go away anywhere soon. There's talk of reduction in restrictions and so on, and that's fine. But we've got to find a way to live with COVID-19. It's not going to go away, okay? And that's based on WHO. It's based on various different professors, doctors, experts, virologists in their field. It's not me. So I'm reading the reports. I can see what they're discussing at a high level, and this is how we help and plan for the supply chain. Don't wait for the governmental reactions. I've seen this a few times, and I've noticed this over the last few months. A lot of companies were waiting for governments to make decisions, whether it's on restrictions or supply chains. Don't wait, react, move quickly. You've got to do this quickly. A lot of the times the government makes decisions which were not necessarily, they may be political, they may have some sort of connotations, there may be local decisions, you know, there may be some disagreements in country and so on. It doesn't matter. Prepare your own supply chain and react accordingly. And always have options. Okay, again, I've seen this over the last few months. A lot of governments that have queried. At one stage, for example, we could see the American government and as the COVID-19 response was increasing there, or the crisis was increasing in America, we had a stage where there was various governments, New York City, for example, California. I had people in these places, in Minnesota, reaching out to me looking for PPE, and yet there's PPE being produced in America. There's PPE available in various other countries, pharmaceuticals of all kinds. As I said, there's various different countries producing and all following good manufacturing processes. Okay, so maybe there's going to be a period where the European Union, through the CE mark or through the FDA, are going to be auditing far more companies and countries. It's an opportunity, by the way, for countries to start developing their pharmaceutical medical supply production. And that's an area which we've been discussing here in Kurdistan and Iraq over the last few months, actually before COVID-19 struck. It's an opportunity to follow the same standards that's in the European Union and in America, and that'll give you an opportunity to sell your goods into these markets. So there's the whole range of opportunity, as well as the initial problem we have with COVID-19. Preparation. I would always strongly advise as well that some of the commercial supply chain operations, the producers, the large pharmaceutical manufacturers, they should reach out to the humanitarian community. This has been discussed within sort of my network, that there's a lot of people out there who have experience in how to react to these situations. We've done this before, you know, and that there's a lot of people who are in this area who have this sort of wide, varied expertise and experience. And it's obviously people don't know that this expertise is available. So there's different tools available, whether it's people or resources or new countries developing and making pharmaceuticals. So again, this is a new experience. This is a new experience for, I'd say, 99% of the world. And that's good. And hopefully this is as big as it's going to get for the world. I've worked in this for, as I say, 10 years. I've seen some really, really large humanitarian health emergencies and have supported them. But this is global. So I'm here in Iraq, I've got family home in Ireland, I've got family in America and family in Australia and various other places. And everyone is going through the same situation today, as everybody who's taken part in this webinar. So we have to look and we have to tear our supply chains apart, and we have to look for new opportunities. And there's a lot of people within, for example, the Middle East where I am here, you know, highly educated, highly trained people. It's a good opportunity for these people to start getting involved in building industries here. So some of the challenges faced in the pharmaceutical production are exactly the same as the food production. Okay, I mentioned this back in January in relation to staff, humans. People work in production, people work in supply chains. So when events like this, especially a health event, which is so unique, it's a novel coronavirus, we're still learning how this affects everybody. People are afraid. So we're human beings. Human beings are in the supply chain. Human beings are involved in production. And we have to, as management or businesses, factor this in, and we have to plan accordingly. People will be scared. They may want to be with their family. They may not want to go to work. I think Dave mentioned something similar in relation to food in the UK and Ireland. Travel restrictions. There's very little we can do with travel restrictions once they come down. As I said, I'm in Iraq. There is no flights and have not been for the last 7-8 weeks. It's only in the last week that they've opened up some business travel, but only by road. So these things come and go quickly. And it's interesting, actually, that when I'm talking to people here in Iraq, as they said with a very dark sense of humor, they have been through lockdowns many times before. Okay, this is not new to Iraqis or Yemenis or South Sudanese and various other countries, or Afghans and so on. Lockdowns are a normal part of life for many people, but for people in the West, as we call it, for want of a better phrase, for people in Europe, Australia, don't think there's been a lockdown in Singapore for many a long year. Okay, many countries, this is a new situation, and that builds fear. And that fear is normal for people, and it goes through the supply chain. It will affect the pharmaceutical supply chain too. The raw materials, they have to be produced too before we can have the end product, to ensure the efficacy of the pharmaceuticals as well, which is going to be a key point. So we were trying to advise various different people, governments, businesses, suppliers, to try and get people on the ground in, say, countries like China, not to do your sort of due diligence just online, because we could see how many times we heard over the last few weeks where funds were transferred from one account to a possible agent or supplier, and then they're vanished and the money is gone. Okay, so there's a lot of due diligence which people in emergency management have been working with for years. So how to not just ensure that the product does exactly like it says on the tin, but to ensure that the money is not wasted. Okay, and the fraud doesn't happen. Increased air freight cargo. So this has been interesting in how, and the photograph I think we show here, how the aircraft have been repurposed, which is very good. You know, so there's a lot of people out there that you can see the innovation, like, you know, the quick thinking in relation to turning around a passenger aircraft into an aircraft that can store and transport freight safely and securely. Okay, so there's many different pieces of innovation, and that is emergency management in action. Procurement. Lack of expertise in emergency procurement. So I've seen this again over the last few weeks and a few months. especially governments. I'm not going to name any specific, but certain governments have been using their standard procurement teams to try and work in an emergency for which they have absolutely no training or experience. It's not their fault. They're completely overwhelmed. They're scared. They're scared for their families. So all of these things are factored in, and they could have a huge effect. When people are afraid, they make mistakes. So when I'm looking at various different issues in relation to procurement that we would see on the news in the medical supply chain, I could nearly picture the people working in the departments. I've been there before. You know, I've been there before trying to manage multi-million-dollar procurements for Syria or Yemen or Iraq, and working with people who are under severe personal stress and strain. It's just a new factor that normal, like if you're working in the commercial world, you're just not going to be familiar with this. Third-party service providers. So again, it's an area which I think has to be developed for medical supply chain. The medical supply chains, as they have been developed over the last 20 years and more, they have been highly effective. They have been able to react to standard commercial strains and stresses, but they have lacked in how to react to a global humanitarian emergency. Or, by the way, it could be another emergency down the line in which it is just affecting, say, China, or it may just affect Dubai, or it may just affect Germany. So we have to plan for these accordingly and have options all the time. And finance, I mentioned briefly as well about financial aspects of a supply chain. It is quite difficult to, in an emergency, to ensure that your money is safe. Okay, money is especially, there's a huge amount of additional funds being spent by governments globally in order to react to the COVID-19. So money, time is money, and money is important. So again, there's a whole range, that's a whole different discussion in itself, but it's something that we need to look in relation to all the supply chains, but especially medical, because it's important that the PPE and the medication is received as quickly as possible because people's lives depend on this. And again, in emergency, I've done this many times before. We've worked in situations in which we've saved lives by improving the medical supply chain. Okay, I think we're going to end there.
Well, thank you very much. It's Keith here again as the host coming in. Thank you very much for that perspective. I pulled out a lot of things in there, but and particularly across the learning across sectors, the need to move from what is basically a reactive approach. I think we heard that very much in Dave's talk, to a longer term planning approach, and just how easy that is to do. We've got about 10 minutes now, no more than that, just to get into some questions, and we're going to be joined by our International President, Radzak Malik, to answer some of those. There are 14 questions here, which hopefully you could all see. I'll start with the early ones. So Usman Shuabu from Nigeria has asked this question about resilience in the supply chain. How resilient is the supply chain with a new business model for long-term disruption? That, I think, takes us into this whole area of how do we move from being reactive into longer term planning, given what we know already, and given the length of this crisis that it is likely to extend for. Who would like to answer that one in terms of supply chain resilience? Dave, can I bring you in?
Yeah, sure. So I think you know, this is obviously going to differ from supply chain to supply chain, but I think you know, some of the areas that are already being talked about in Europe, I mentioned that labour availability is an ongoing challenge, and maintaining productivity. So there's already talk about increased levels of automation, robotics. I think that will be accelerated. I think building on what Will was saying about ripping apart your supply chain. I think a lot of the supply chain designs have been around low cost. Over the last few years, I've heard lots of phrases around, lean and inventory is waste. Well, I can tell you that right now, inventory on certain products is not waste. It's very, very precious. So I think there will be a lot more thinking within supply chain design about risk, rather than lowest cost. And I think I don't think that's easy. It's when you look at cost, it's relatively simple decision making, but getting the balance of risk and what is the value of low risk versus high risk. That's a difficult thing to do, but I think that will definitely be elevated within supply chain thinking and supply chain design. And I think the sort of balance between procurement decisions will change as well. So a couple of thoughts there, but I think even in the short term, the ways companies have adapted to COVID-19 in the short term, a lot of it isn't sustainable, and it needs to move quite quickly to a more sustainable. And as Will says, COVID-19 isn't going anywhere very soon, and so we need to move from emergency measures to a more sustainable solution.
Well, you particularly were talking about how we need to move into a learning situation and be prepared to look outside of sectors. But the other area is also, at the moment, if you look globally, people are reacting very much locally. How do we enable ourselves to look and learn more internationally, to develop a supply chain model that's going to suit the next 3 to 6 months of this crisis? There's a good question for John Core, from John Core in there, about the next phase in terms of once we get into, let's say we get a vaccine, and how do you distribute that internationally? And how do we learn from the fact that every country grabbed its own PPE and focused on its own national solution to that? And when you get a vaccine, if that's developed in a country, how do we move that globally? How do we share that globally? How do we deal with that internationally?
Sorry, the first part of your question
was really, in essence, how do we move from being reactive and local to being more?
I think realistically, Keith, over the next, people are talking about, say, 3 to 6 months. Okay, I think people should be looking at 12 to 18 months in relation to whatever supply chains we develop. And as Dave mentioned already, I've mentioned as well, there's different supply chains for different products and requirements. Industry has to happen. Okay, we have to get to a stage where industry can get back up and running again. So there's going to be new guidelines, there's going to be new protocols for people traveling on airplanes, for freight traveling on airplanes. Costs will increase. How will the consumer actually react to the increase in cost, say, of pharmaceuticals? Okay, there's certain pharmaceuticals that have always traveled by air just because of the very nature of their the time frame you have to use them. Okay, vaccines, for example, have to travel by air. There is no choice. Okay, under strict temperature controls. Realistically, as somebody said a couple of days ago, they've been working on a HIV vaccine for 30 years and have not found one yet. Okay. Now, again, I'd be a brutally honest type of supply chain manager person, in which I would suggest that people need to be parking the possibility of a vaccine in the, as I say, 12 to 18 months. Okay. But that does not mean everything has to stop and stay as it is. We need to have conversations now about how do we change our supply chains? How can we make them efficient but safe for everybody to take part at all stage? From the, as I mentioned earlier, we're talking about people here. People. We're involved at every stage of the supply chain. So we have to make it safe, from the guys working in the production plants, in the warehousing, in the transportation, all the way down to the chemists, pharmacies, and customers purchasing the goods as well. So we're going to find a new way, a new normal, as it's been discussed.
Yeah. That's a number of questions that come in on safety, and this it's actually a very different way of looking at how do you deal with there's 3 or 4 questions there in terms of this clash between productivity and health of the employees. And we read of people like Amazon already having to, or being challenged in terms of their own approach to how they manage their employees. Radzak, I'll bring you in here in terms of, so Malaysia has been very successful in its lockdown. How successful are you, do you think, going to be in terms of restoring operations so that people can deliver things and people can get back to work in a manufacturing sense? And how should employers tackle that? What comes first, safety or productivity in the new norm?
Yeah, that's a good question actually for me to answer. First and foremost, let me have the privilege of informing you, since we're in the COVID environment. Today in Malaysia, 6 May, we have 135 cases discharged, 45 new cases positive, and 1 death. This is the 3rd day of our MCOC, Movement Control Order Conditionally. Meaning to say, after 4 MCOs, the 5th MCOs, the government of Malaysia has given some kind of relief to the people, and mostly economies is going to develop and all that. The only problem with some of our people, even in Malaysia, I observed that a lot of people are talking about logistics and transport. They seem to know so much about logistics and transport. I happen to be one of the Malaysian service sector industry as a president and as a counsel to Ministry of International Transport and Trade. We had a team of a task force being formed in Malaysia to look into how do we get the professionals, be it in the construction or in the legal or IT or accounting and all that, to open their business. And when I just want to shorten everything, when I propose that we also have to look into the issue of logistics and transport, they just like immediately trying to snap me by saying, oh, no, logistics and transport is essential, essential services. So we don't have to touch on logistics and transport because it's essential. Government has already given right from day one. But they really knife about what logistics and transport is all about. Because when you talk about transport, you talk about logistics, there are strings of activities. Whether it is the upstream or the downstream or related to it and all that. Let me tell you, how do you clear containers at a port when you don't allow, you know, the crane operator to work? And you don't consider crane operator as part of the transport. If they're bringing rice from the government warehouse to another government warehouse, or from the from the factory, if the transport is sending masks and PPEs, that is different. But when you are talking about you want to clear containers, when you are talking about there are some we don't talk about if trucks need breakdown and they need repairs and all that. They don't consider all this. That is why I said sometimes this is my in my country. I'm talking about in Kuala Lumpur, but I believe all over the world, the only thing that it's easy for them to say logistic and transport, but they do not know the string attached to all those. And if you don't have that chain, value chain attached, definitely, transport is nothing. And today, do you know that even in Malaysia, you need to give special permission for the port to open, for this, for the containers to come in. And how does this container clear? Because container, imported into into Malaysia cannot be released from the container depot because factories are closing. So the whole supply chain, this is what we are talking about. So, well, I'm grateful to my government because they conditionally has tried to open. And I can imagine, how difficult it is for food and medicines when even containerization is so difficult. Well, it is good news that we in Malaysia has flattened the curve, but the bad news is COVID-19, the virus will still remain with us until we get the vaccine. And as you rightly say, Keith, how do we transport and distribute that vaccine? Now, those people who are producing the vaccine, they want to use it for their own. I don't think they want to give to other people first. Whatever the balance will be given. But anyway, there is another story for us to discuss.
Yes, thank you, Reza. Well, unfortunately, this is our second webinar. We're learning as we go. There, I think Will touched on it. I think the whole situation is bringing more problems than solutions, but it's very much our purpose as CRT to talk about this internationally and seek solutions as professionals across the supply chain. And it's wonderful to see so many of you on the participant list from so many countries. We have another one in 2 weeks' time. That is focused on passenger transport. So watch out for that, and we'll have a bulletin out next week. I'm afraid I'm going to have to cut us here because we have run out of time, and our president was going to finish off with a few closing remarks, but yes. I think probably, Dati, do you just want to finish us off just with just a minute or so, and then we will close the session. And thank you very much, everybody, for joining.
Thank you for my closing remark. Thank you for the two excellent speakers for covering this critical subject of both food and medicine supply chain, and for the excellent question asked. You have heard two very different in-depth understandings of the challenges in the supply chain and how to respond. Wherever you are in the world, there will be local differences, but the professional response will be similar. Now, this second webinar in our series forms part of our response to the current issues facing our CILT members and our profession across the world. Our CILT response is to use our strength of working together, sharing international business examples as part of our global best practice, resource to help you think about and determine appropriate responses locally. This webinar has been recorded, so So please share the recording with your members and colleagues in your country and region. Join our online discussion and participate on our international and branch social media platform. Now, next week, we will issue our 4th bulletin focus on safe practices in passenger transport network, as Keith mentioned just now. Now, please share our local research and expertise in this area, and we will be holding our 3rd webinar on this subject on 20th May. Now, finally, my thanks to you all again for joining us today. Stay safe, stay at home. Goodbye, and good night.